Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin Hung. The world of healthcare and technology are ever changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. Today, we're going to be talking about the death of retail health. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 18 years of healthcare IT blog content at healthcareittoday.com. Did you ever go to a retail health, Colin? Did you ever go and see? Have you? Yeah. For me, it's like my primary care doctor. So I love it. I love the convenience and I can't get away from it.
The only retail health we have here in Canada is dentistry and eye doctors. So,
Uh,
so I have experienced those, but no, we don't really have retail health clinics. Like Walmart never had those up here or anything.
Yeah, and never at a conference you like needed a quick visit, thankfully, or
Thankfully not. I mean, I did
knock
go to
on
those
wood.
pop-up immunization, or sort of the pop-up testing centers that came up, that were offered inside some retail clinics. So I did sort of experience that, but not where I needed actual to get care or anything.
Yeah. I've had some bit of mixed experiences, with retail health. Some super smooth, amazing experience, cheap, convenient, scheduled online. And then a couple times I go and they're like, oh, we can't treat that. So, I definitely have a bit of a like love hate, but like when my kid needs a physical, when something simple that I know they can do, it's like, oh, it's so convenient.
So John, let me ask, were you shocked when, Walmart, Dollar General, and others shuttered their retail health clinics?
What was shocking to me was actually kind of the post-mortem we saw from Walmart, where they're like, oh, we were losing a lot of money by charging so much less. And you're like, you didn't talk to the right people that understand the healthcare economics and how much doctors cost. Like, doctors aren't cheap, and let's figure out the right economics to be able to make this happen. So that was the surprising part for me, was like that they didn't do the math, because that I mean it's math that people know, right? Like, we have how many medical practices out there that you could have talked to and said, how much do you get paid? How much does a doctor get paid? And I'm sure Walmart was fine, like, hey, we need to be the low cost leader, right? I mean, that's their brand, is low prices every day, and they needed their clinics to be that as well. But the fact that they hadn't done the math to know how much money they were going to lose if they're the low cost leader with a clinic, that was shocking to me. And so, like, once I heard that, I was like, oh yeah, well, if that's your math, that's not a surprise. I'd shut it down too.
Yeah, no, you're right. I mean, it was a little bit shocking that they didn't make any money because, and as we know, looking at the prices they had charged and reading about it when they launched it, it felt to me that where Walmart seemed to want to make their money back was around the actual retail part of their business. Like someone would go shopping, there'd be an increase in same store sales, there would be, or that store's sales, there would be an increase maybe in the pharmacy, right? Because you would go see the retail clinic doc and then you'd go right to the pharmacy. So that part of the economics was surprising to me, that they actually didn't see a significant enough bump in that business to justify maybe the loss that we kind of figured they were going to incur running the retail clinic. I mean, they kind of couched it in the terms of the postmortem that, the retail clinic itself didn't make a lot of money or lost a lot of money. But to me, that was always going to be the case. Like the amount they were charging didn't make sense to me. So I was shocked that the follow-on business didn't happen.
Yeah, well, and maybe that's the real postmortem that they didn't share, is that it didn't drive a lot of extra traffic, which kind of makes sense. How many visits can you get in a day? Maybe at the max, like, this is like destroying your provider, 30 a day, right? Like, and what, you could have two or three if you wanted. So you're talking about less than 100 extra customers coming into your clinic, into your store to spend money. So it's like, okay, that math is probably off too, right? And unless they're all, like you said, they are going to the pharmacy, maybe you can make it up there, but they're offering cheap prices at the pharmacy as well. So it's like you can't dip everywhere and then be like, wait, how come we're losing money? So, that it's fascinating to see. But there's another element to this that's been even more interesting, and the shocking thing for me is how quickly this happened, which is the announcements of who's using the clinics that were created in these Walmart stores, right? And so I forget who the organizations are, but they essentially went to traditional healthcare organizations and said, hey, we have this doctor space that we created. I'm sure they invested a lot of money making it work for a doctor's office. And so now they're subleasing it or whatever to a traditional healthcare player, which then you look at that and you're like, actually, that achieves the same goal, which is those, I guess now if I estimate 100 people are going to come and do their shopping there, right? When they come in for the doctor's visit, and it only costs them the real estate, which in the macro is probably a rounding error for them, since they have, I mean, they do talk about shelf space and different things that they could do otherwise, but there's such big pieces of property that were purchased in good times that it's probably not a huge expense. So they're probably still getting the same benefit by working with traditional players rather than doing it themselves.
Yeah, and it's a great point you raised that, we'll see how that business survives or not, right? Or these clinics that have moved in, traditional players who have moved into those spaces. Because you're right. I mean, they spent all that money renovating them to suit a doctor's office. They could be well suited for that purpose again, just not running it themselves. I was actually a little bit surprised at the speed at which the things were shuttered. Like it was literally overnight, right? Like it was, I think they didn't give a lot of lead time, but I think that's the nature of retail health. It wasn't like they had tons of patients that they needed to see 6 months from now or 3 months from now. It was just sort of walk up, walk in kind of business. So they could shutter them fairly quick. But that was the part I didn't read a lot about, which was the shockwave in the community, right? Like there wasn't sort of this outcry to say, hey, now I can't get care, or there wasn't that wasn't a lot of stories around that, and I thought there would be. So that was a little bit of a positive surprise to say, oh, I guess people weren't really relying on this too much, because otherwise I think there would have been a bigger outcry.
That's a good point. I mean, if I had an appointment scheduled 2 months out, we haven't heard a lot of complaints. At least I haven't seen any stories of, mass patients saying, "Why did you do this? This was my health care." Yeah, that is, and maybe, I mean, that we call this the death of retail health. Maybe that's the biggest sign about the challenge of retail health, is that it's not an essential feature in our healthcare system that we all feel just has to be there in order for us to survive. It's nice to have, it's convenient, and but it's not something that's like, oh, if it's gone. Whereas if you lose a specialist in a city and they're the only specialist, that's kind of a big deal. If I got to travel multiple hours rather than having one in the city, so I think that, yeah, that's probably a bigger sign of why retail health is a nice to have. It's not a essential.
And we called this the death of retail health. There are still some retail players still in the market, right? There's still Walgreens, CVS, and Amazon. But do you think, John, that they're headed maybe for the same endpoint? Meaning, are we really in the twilight of retail health?
Yeah, I mean, I think Walgreens is headed the same. The way they've shut down a lot of clinics and the Village Medical stuff, they're kind of already down that path to a large extent, and kind of, it seems like the writing's on the wall there. Well, CVS has the Minute Clinics. I don't know. I think they've taken a more cautious approach, and I've done some visits there, and I think they know who they are, and it's using nurse practitioners, it's using lower cost ones, right? And they only do a certain set of things. So I think they probably have a little more staying power that way. And I mean, I'm shocked at how much CVS has shifted to a healthcare company, not even selling cigarettes and things, right? Like, I mean, because they wanted to embrace that they're a healthcare company. And then Amazon to me is a totally different ball game. Now I don't know how One Medical plays out. Just like I mean, Whole Foods is interesting that Amazon owns Whole Foods. I mean, at least that has some delivery service. They needed more drop locations, etc. That and it was a good business anyways, right? Whole Foods was so they have both sides of it. That makes sense. But so I don't know how One Medical plays out, but I think the Amazon virtual services. I'll be surprised if that doesn't have some staying power. That feels like something that could be quite effective and useful. And when I see how they're marketing it to me as an Amazon Prime member or whatever, however they got my email, like it's interesting. It seems different and it feels different. And when you see their advertisements, they're like, get your drugs at Amazon. I'm like, oh, okay. Like, they, get a free visit, or go and have an inexpensive visit. It's like, oh, that is worth trying, right? So I think, it's kind of a different version of that. Now, how does that bridge to One Medical? Do they expand One Medical? That I don't understand.
Yeah, I'm with you. I think the writing's on the wall with Walgreens and their Village MD. I think unfortunately, they're going to go the same route. They're going to close them all, or or go right down to we got to repilot this to figure a way to make it work. CVS, I agree with you. I think they've chosen a much different approach. So I think they got longer staying power. But I got to be honest, I think they're heading for the same conclusion,
Yeah.
which is it's nice to offer, but I don't think it's so much tied to the convenience of being inside the pharmacy. And I say that because we're also seeing on the other side pharmacists now being able to do more medical things, right? And so if that continues to increase, albeit slower than we all want, it still represents, well, I don't need a nurse practitioner there if the pharmacist can treat these 25 common ailments now, right? Like a UTI and other things. I don't, they can do that. So as that increases, do we then not need a minute clinic inside a pharmacy anymore? We could just go to the pharmacist. So I see the Walgreens and CVS maybe heading for that same conclusion. Um, Amazon, though, I agree with you as well. I think it's completely different. Their approach to retail health seems to be much more the telehealth route, much more centered around ordering your drugs through them. And so we'll see. And plus, they have the deepest pockets, right? Like they can weather this the longest.
Yeah, but will they? I mean, I think they're
Yeah.
one of the smartest people though that says, "Hey, we know our expertise and we know where we have margins, so we're going to approach that." And I think that's been the challenge is that so many of these big box organizations, these large tech companies, etc., they look at healthcare and they're like, it's a 5 trillion or whatever, 3 trillion or whatever number trillion it is, right? Anytime you say trillion, they're like, ooh, we should be in there, right? And so they just assume that they can go in and take some of that money, and then but they don't understand the cost dynamics associated with healthcare. And so I think that's why you see Walmart going all in and then being like, ah, never mind. Again, it's shocking to me that they don't understand the cost. But I have a feeling it's some MBA executive, no knock on MBAs, but that just was like, well, it's a $3 trillion industry. We should tap into some of that. We got extra cash. What are we gonna do? We're not in that industry. Let's go there, right? Like, and so you kind of get where they're coming from. It is a massive industry, and there's a lot of money to be made, but you have to understand the economics.
Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we're talking about the once shining star known as retail health. So, John, let me ask you this one. What are some of the good things or some of the lessons learned from retail health?
Yeah, I mean, I think the biggest thing for me, and I actually see this as a great, like the fact that retail health happened made everyone else wake up and say, wait a minute, am I going to be in trouble with Walmart and my clinics, right? Like, because my clinics are my referral sources for my orthopedics and for my surgeries and for all these other things that I do. And so I think it made a lot of executives say, wait a minute, we can't do what we've always done. We need to adapt. effort. And so I love that part. And that's probably the best thing that came out of this whole retail health effort, is that so many other healthcare organizations said, oh, they're offering online self-scheduling. We should do that too, right? They're making a convenient way to pay. We should do that too, et cetera, right? Same day appointments, all of these things that you're like, well, why didn't you do it before? It's like, well, we didn't have to, but it kind of forced the issue and said, you know what, we should wake up and we should make this more convenient to the patients, because if we don't, someone else is going to take our business.
Yeah, hard to argue there. I see that as, you know, the one benefit of Walmart and all of these folks getting into the market was it sort of accelerated what healthcare organizations, traditional organizations were doing in terms of the patient experience, the convenience aspect. I think the patients realized, oh, healthcare can be done this way, forgetting about the quality of the care, or you could argue and all that stuff. You know, the fact that Walmart had a much bigger parking lot, right? And it was free. But just the fact that, yeah, you could do a lot of the stuff online, like booking an appointment, finding a doctor, finding the times that were available. And that has improved for the industry as a whole. And it is a great thing. And I think that's one of the, hopefully will be, and it is one of the lasting changes that were brought about because retail health existed. So even if it goes away in the future, at least we had this benefit for sure.
Well, and I think what's interesting, and maybe the other benefit that we're going to get from the efforts of retail health, is it's shined a light on the cost structure of healthcare and how screwed up some of it is. And so I think it opened a lot of people's eyes into this weird cost structure around co-payments and how we think about healthcare, and sick care versus wellness care. It opened up the kimono a little bit for a lot of people to say, hey, one, care is often more expensive than you think, right? And there's a lot of reasons why, including doctors that are expensive, pharmacy that's expensive, et cetera, procedures. So I think maybe if that's another good thing, is that they force the price issue and the cost issue. What's the cost and how much are we charging for it, and how many things are subsidizing other things in healthcare in a way that probably isn't healthy for a nice market to be working. And so I think it offered some transparency into the pricing of healthcare that will probably have a lasting impact as well.
Although I do wish that aspect of patient price transparency, unfortunately, didn't roll over into the rest of healthcare, right? Walmart did have their prices listed. It was very clear what they were charging. That didn't spill over, right? And I think part of it is because cost is so nebulous in healthcare. I don't think they could. I mean, a lot of hospitals today struggle with trying to be price transparent because they don't even know their own expenses and costs. It's hard to calculate. Um, and unfortunately, that wasn't something that carried over, right? Like we still don't see a lot of prices published in a lot of places, even though that was a legacy of what Walmart and others did.
Yeah, well, and the government's been working really hard on that whole price transparency thing, and they haven't made that much progress, although they're going to keep hammering on it. So I'm interested to see if a healthcare organization really will dive in and say, hey, we need to be transparent about what's really happening. It probably will require them negotiating different contracts and different rates, because some of the rates they're doing are not very in line with the costs associated with the service given. And so I don't know how that's going to play out, especially with the government coming after as well. But it is interesting to see. I think the other thing that's interesting coming out of retail health and what we've learned is that patients do want convenience. I don't know, all these, this is our 148th episode, right? And I'm even more confident today that convenience is like the ultimate player, right? I think we would go for convenient over quality, even, right? Like that, probably at the end of the day, it would be a bit of a battle, right? And we've talked about before, how do you measure quality? That's the real problem. But man, convenience is such a compelling factor when in a competitive environment, that if you can create something that's more convenient, we want that. And I don't know, it's interesting. I don't know, maybe Canada is different, but in the US, we have this culture of, I'm going to make this so convenient for you, right? And technology's done that for us. Uber made it uber convenient to order a car, right? Or to deliver food, or Amazon made it so convenient to just order anything you want. I don't even think my mindset has fully shifted to that, by the way. I was like, oh, wait, it's a birthday 2 days away. Oh, I'm so late. I can't order online. I'm like, no, actually, I can, right? Like, because it is so convenient, which is probably, I'm slow, but, convenience has become such an essence of our culture that we saw that was true for retail health too, that they loved the convenience.
Actually, MDRG did a study around this, right, as to what people valued and how they chose their healthcare providers, and convenience was one of the biggest factors. But what was interesting that what they found was it was certain cohorts, right? People with multiple chronic conditions did not value convenience as much as quality. But those who didn't have chronic conditions, who maybe have more episodic care, definitely convenience was the number one factor. And so that was kind of, I think, how Walgreens, and others have designed their clinics, right? They're not meant for someone who has, 6 conditions, right? And something very complex. You would still go to your normal primary care provider or the hospitals for that. But for those that were more to episodic care, you're right. I mean, convenience is number one, and these proved it. These models showed that it was A, viable, and B, it was what people wanted.
Yeah. I
So
think the challenge though, when you look at that though, look at the chronic condition, someone who has to go all the time, it's kind of a sad state, because my guess is they've just resigned themselves that it's not going to be convenient, which is kind of a sad state, right? For these people that are dealing with it, and a lot of them are older people. I've seen where it's just their lifestyle is going to the healthcare. So maybe they don't need it convenient because they have plenty of excess time, but it's kind of sad that they're wasting all that time.
it
So,
is. So John, what do you think the future of is for retail health?
so I think what is probably going to happen is someone's going to try it again. Like, it's just too insatiable. And so I think we're going to have someone try it again. I think even the Walgreens, Walmart's, Dollar General may try it again, but they might try it in different ways. I've even seen, I did a podcast pretty recently where they were using banks to do some of the telehealth and the visits and things. And I was like, wow, what an interesting model, because it turns out banks are distributed and they have excess space. So I don't know who it's going to be, right, necessarily, but I think someone else is going to try it again, because they do see this as an opportunity. And the wait list for many organizations is really long. And so that's the other thing that's kind of driving this, which is, oh, if I call my primary care doctor and they're like, yeah, see you in 2 months, like that's not going to work for me, right? I'd rather go somewhere else. And so I think someone is going to try it again. And I actually think that there could be some mainstream provider healthcare organizations that, kind of the old guard, if you will, that they do a bit of that, right? Where they dive into and say, hey, why aren't we doing a bit more of this retail health style? And we see some of that, right? In Vegas, we have urgent cares, which we know about, but they also have something called convenient care, which is almost like, I think in this case it was Optum or someone like that, that United Healthcare owns it, doing this convenient care, which is almost like them doing a retail health model, but under the, old kind of the traditional healthcare system.
Yeah, I'm with you. I think there'll be a lull, where, we'll still have this fallout. It'll be on the decline. The shine is taken off. I don't think we're going to see a lot of VC dollars and those kinds of things flowing into retail health for a while. But I think it is still, to your point, too much of a shiny object that it will attract other players down the road. I'm not sure who those other players are. My guess is someone like what you mentioned before, like someone like a Best Buy Health, where what they're selling is not prescriptions or groceries or household items, but maybe stuff related to care at home. right? And those are much higher dollar items than groceries. And so could they make it work, right? But to say, yes, drawing those people in, they're right there. You can make the recommendations for these devices now that they can buy and take home. That may be something. And we know that organization, Best Buy, is shrinking their footprints in terms of their retail space, right? Unlike a Walmart, right? So they have excess space. They could turn it into this clinic, but maybe partner with somebody rather than offering it themselves, right? So I agree with you. I think we're not going to see for a while someone wanting to be the provider, but maybe to have a provider co-located with them might make a lot of sense. The other one I'm thinking as well, though, is the direct DPC market, direct primary care. We've seen a lot of those stocks who already provide this sort of retail experience, but have teamed up with not a retailer, but places like gyms and rock climbing places, right? Like actual wellness, right? Yoga studios and so forth, and putting their clinics next door to them, or actually even owning the yoga studio too. So I wonder if that model is maybe the one that we will see emerge from this sort of lull in retail health. That we're actually going to see a sort of wellness centers get created, where it's a lot more around that, where there's a provider just happens to be there.
Yeah. No, you bring up some interesting points. Like, I think the Best Buy healthcare is really interesting, because they're not going to open clinics in Best Buys, right? Like, I don't think that's part of their vision. They've taken a much more thoughtful approach, I think, which is, hey, we need to be on the home health bandwagon, which is a growing part of healthcare and a growing opportunity, especially as we have more aged people that need to be monitored at home, and or they're living longer, etc. So they're on that bandwagon, whereas they're not going to open up a clinic at the Best Buy, even though I heard that there's a Best Buy within 10 minutes of everyone in the US, or 90% of the population, or some crazy stat like that, right? Like, so there is a Best Buy close. And so they've been very thoughtful about, hey, you can come to Best Buy and pick up the device that you want because it's very close. Or if you don't want to, we have the Geek Squad that can bring it to you and deliver it to you. And it brings up a lot of interesting questions. What about short-term stuff? Like, as you leave a surgery, could Best Buy play into that? Like, that's pretty interesting, right? Becomes part of the home health and is a bit of a retail health play as well. Let alone, all the explosion we're seeing of wearables, sensors, monitors, and then there's got to be a couple players that are going to roll out full suites that monitor your health using, I got the Con Ring on right now, right? Like the Ring Con, that is monitoring me and probably spiking stress right now because I'm on camera. They're going to take all of this data and put it into a package to say, hey, you want a telehealth visit to evaluate your blood pressure for the last 3 months, let's do that, right? And could someone like a Best Buy Health be involved in that? Absolutely. And that really expands their market. Of course, they also have the market. They bought, was it Great Call, I think was the acquisition. So the one where they can if they've fallen and they can't get up, that's the famous kind of fallen and can't get up, but like next level technology where they can do the call center and talk, which, by the way, they've expanded those services too. Now it's not just emergencies. Sometimes they just call the call center at the highest plan and they just talk about loneliness. And I was talking to a Best Buy Health person and they said, yeah, sometimes people will call the call center for 3 hours and talk to the call center agent just because they're lonely. And they're like, wait, that is a different type of care, but it is still care and it's still influencing that person's health in a really big way. So anyway, long diatribe on Best Buy Health, but who else is going to do that is the question. It seems like there's some other opportunities for others to get into the space as well.
Yeah, I think the bottom line is that I think the future of retail health is that we're going to redefine what retail health really means. That it may involve retailer, but not traditionally what Walmart or Walgreens has done. Maybe something a little different. But hey, thanks to all of you who tuned into this episode of Healthcare IT Today. You can find out more details about our show by checking out the programs page on healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on social media using the hashtag HITSM. I'm Colin Hung with my friend and Health IT collaborator, John Lynn. Thanks for listening and have a great week.